Hi, this is Studenic from the Karolinska Institute in Stockholm, reporting for Room Now from the virtual EULAR Congress 2021. So today we had a wonderful EULAR morning session on treatments in psoriatic arthritis. And in this regard, I would like to highlight actually three abstracts. Laura Coates presented the 2021 GRAPPA treatment recommendations in psoriatic arthritis with the number OP0229. Atul Daftar brought sub-analysis concerning axial involvement of psoriatic arthritis patients using data from the SELECT PsA 1 and 2 study with OP0233. And Philip Mee shared with us 16-week data on deucravacitinib with the number OP0227. So GRAPPA, it's the third edition, a huge collaborative effort, definitely. And the main new points here, it outlines an overarching principle that putting all these recommendations in the context of shared decision-making. And furthermore, into an integrated management plan, taking not only now the classical related conditions like uveitis, into account, but the whole spectrum of comorbidities that is observed and is increasingly more apparent over the last years. Also, reproductive health has been emphasized as one part to integrate in that. And since the therapeutic armamentarium has extended to the benefits of the patients, this is, of course, also very much needed due to the heterogeneity and the features of PsA that may occur during the course of this chronic disease. Coming to upadacitinib and the abstract of Atul Daftar, upadacitinib, a JAK inhibitor, particularly JAK1, is here the data of SELECT PsA 1 and 2 has been used, and the specific question was actually how about patients with axial involvement and efficacy and safety. Upadacitinib is efficacious, has been proven efficacious in psoriatic arthritis as well as ankylosing spondylitis. And here, the 12-week and 24 weeks time point has been taken into account with the 50 milligram doses and the 30 milligram doses. And about 30% in both trials showed axial involvement. And what was interesting to see is that people with axial involvement had higher tender joint counts, they had more dactylitis, more enthesitis, and also longer morning stiffness, duration of morning stiffness. So good news that relevant outcome domains actually all showed beneficial improvement in comparison to placebo at week 12 and 24. And what is to highlight maybe is the BASDAI that decreased with a mean of about 2.6 after 24 weeks. That also, when you exclude question 3, which is about the peripheral joint pain, you see a similar mean change in this score. So these positive results could also be replicated in the ASTAS, and I think the ASTAS clinical important improvement rates were quite nice, with 60% in the active group and 20% in placebo. And this strengthens, of course, the evidence for upadacitinib in psoriatic arthritis patients with also axial involvement. So now coming to the new kid on the block, deucravacitinib, which is a TYK2 inhibitor. So this drug binds the TYK2 regulatory domain and via that then inhibits cytokine pathways. It has already been shown efficacy in moderate to severe plaque psoriasis. And this trial presented by Philip Mee showed the week 16 results with the psoriatic arthritis patients and musculoskeletal symptoms And these patients were allowed to fail up to one TNF inhibitor as well, but who had active disease and at least fail one conventional synthetic DMARD and a 6 milligram and a 12 milligram dose in addition to the placebo arm was tested here. The primary outcome ACR20 response was met with about 50 to 60% responses and 30% in the placebo arm, but more of interest, of course, with ACR50 is 24% in the lower dose of 6 milligram and 32% in the 12 milligram arm. In placebo, this was 10%. But composite scores are in particular importance besides single indexes like patient global that all decreased. The PsA and the PsA could reproduce these nice results at also week 16 with 23 units of mean change in the PsA and 2 units in the PsA. The minimal disease activity was also reached in 23%. Concerning other features like enthesitis score of 0 in the Leeds enthesitis and the SPARC was observed in about 50% of patients of the active arm. Safety is, of course, also always of high importance, and there were no serious adverse events in the trial period, also no opportunistic infections or herpes zoster. By that, I would like to close that these trials highlight this growing basket of options what to choose for treating our psoriatic arthritis patients. And this great benefit means that the personal situation of the patient with all the possible associated features needs to be taken into account for the ideal treatment decisions. By that, thank you very much for watching. Further enjoy Euler. Tune in for more content on Room Now. You can also follow me on Twitter using @studio as